timer.
Thank you. We will, for this last presentation, we will explore how working conditions affect nurses' relationships with vaccines. This study is part of the ICOVAC project, which examines the impact of COVID-19 on vaccination in France from 2023 and 2024. One work package is focused on the pandemic's impact on healthcare professionals, coordinated by Pierre Verger. Some contextual elements. C'est bon. Nurses play a crucial role in vaccination efforts. They represent the largest healthcare profession in France, with 640,000 nurses. They maintain close relationships with patients, which allows them to influence vaccination practices. Furthermore, many countries have expanded nurses' vaccination-related responsibilities, such as granting them the authority to prescribe vaccines as a response to the shortage of doctors. This is the case in France, where since August 2023, nurses have been authorized to prescribe all vaccines for patients age 11 and older. However, numerous studies have highlighted significant vaccine hesitancy among nurses, whether in terms of personal vaccination uptake or trust in vaccines. There is a clear professional gradient. Nurses are much more hesitant about vaccination than doctors, and they are less hesitant than nursing assistants. One frequently cited explanation for this hesitancy is education. From this perspective, nurses' vaccine hesitancy is primarily attributed to a lack of knowledge and information about vaccines, their benefits, and the risk-benefit balance. While this explanation is interesting, we believe it does not fully capture the complexity of the phenomenon of hesitancy. Several studies have highlighted links between negative perceptions of working conditions and personal vaccination behaviors.
The significance of work is a prominent theme in classical analysis of sociology of professions and occupational groups, which have shown that professional socialization is a critical element in shaping individual trajectories and experiences, including those related to health. Specifically, research has demonstrated that work influences aspects that go beyond job-specific issues. Additionally, recent studies have emphasized that the role of organizational climate, the shared perceptions individuals have of their work environment, and compliance with anti-COVID-19 measures and acceptance of COVID-19 vaccines. Working conditions can thus influence political engagement, opinions, institutional trust, voting behavior, and attitudes toward health. This can be explained by the fact that the workplace is a space where individuals encounter structuring social experiences, such as power dynamics, domination, or conversely, empowerment and fulfillment. In recent years, particularly since COVID-19 pandemic, nurses' working conditions have deteriorated significantly, with a large number of professionals expressing dissatisfaction with their working environment. In this presentation, we examine how working conditions can shape French nurses' attitudes toward vaccinations for both themselves and their interaction with their patients.
To explore these issues, we drew on two studies, one quantitative and one qualitative, focused on French nurses' working conditions and their relationships with vaccines since the COVID-19 pandemic. The quantitative study began in February 2023 with the support of the French National Order of Nurses. All nurses registered with the order, including both salaried and self-employed practitioners, were invited to respond to a questionnaire focused on three topics: satisfaction with working conditions, key psychosocial determinants of vaccine confidence, including attitudes and vaccination behaviors, frequency of vaccine recommendation, especially for flu and COVID-19 vaccines. Of the total invited, nearly 19,000 nurses responded. At the same time, we conducted a qualitative study with around 40 nurses, both self-employed and hospital-employed nurses. These interviews, conducted between 2023 and 2024, explore professional trajectories, perceived working conditions, experiences during the COVID-19 period, and attitudes toward vaccination. Part of the discussion also addressed the recent expansion of nurses' vaccination-related responsibilities in France. The quantitative study, consistent with prior research, revealed a relation between working conditions and vaccine perceptions. Using mediation analysis, we demonstrated that satisfaction with working conditions influences trust in health authorities, confidence in vaccines, and proactive efficacy. These factors, in turn, impact vaccination recommendations. These relationships were consistent for both salaried and self-employed nurses. For more information, we refer you to the article we wrote in the International Journal of Nursing Studies, published in October.
Yes, today we aim to delve deeper into the mechanism behind these relationships, focusing on how nurses' work environment shapes their vaccine perceptions. Specifically, how does professional socialization play a crucial role in nurses' ordinary relationships to vaccines? We won't present an exhaustive account of our quantitative and qualitative study, but we'll focus on key results that allow us to partly explain the level of mistrust or involvement in vaccination. One possible explanation for different types of engagement in patient vaccination may lie in distinct professional roles on nurses which could shape their attitudes. Nurses' professional socialization often emphasize dependence on doctor diagnosis and prescriptions, coupled with caution about treatment and side effects, treatment risks and side effects. These socializations perpetuate their lack of decision-making power in diagnosis and treatment. As a nurse explained in an interview, we are still under the medical thumb. It's really strong. For everything, we need validation from the doctor, we need prescriptions, and many of us feel like we are just executors. Additionally, nurses are socialized to prioritize care and patient listening. Our qualitative study shows that their role often aligns with respecting patients' autonomy, even if where the vaccine hesitant. So this is the second passage. If someone doesn't want medication, so they won't take, my role is to inform them. Beyond that, it's up to them to decide. I'm not here to force anyone. It's the same with vaccines. I'm here to explain the benefits for them and society, but if they refuse, they refuse. We're here to give people the tools to make an informed choice, not to pressure them. So we can see, comparing vaccine hesitancy between doctors and nurses often overlooks the distinct roles they play in patient vaccinations. But this role also differs between hospital nurses and self-employed nurses.
Beyond initial professional socialization, we must consider differences in working conditions. Though they share the same education, the working realities of hospital and self-employed nurses are vastly different. Our qualitative study revealed that legal changes, such as the expanded vaccine prescription rights for nurses, were widely known among self-employed nurses, but largely unknown among hospital nurses. This lack of awareness among hospital nurses highlights differing professional roles in vaccination. Before addressing nurses' satisfaction or dissatisfaction with their working conditions, it's essential to recall that these roles differ significantly. In France, hospital nurses, representing the majority of French nurses, more than 60%, they are less involved in vaccination, where self-employed nurses, making up around 20%, they are more directly involved in vaccination efforts, such as flu campaigns in clinics at patients' home or HPV campaigns in school, for example. In our quantitative study, self-employed nurses were slightly more likely than hospital nurses to recommend flu and COVID-19 vaccines, and they also reported feeling more engaged in vaccinating their patients. In addition to professional socialization, the lack of recognition for nurses' work may further explain their varying levels of engagement in vaccination efforts.
A lack of workplace recognition emerged as a key explanatory factor for nurses' disengagement with vaccinations for both themselves and their patients. Our quantitative studies reveal significant dissatisfaction among nurses. Around 70% of both salaried and self-employed nurses believe their skills are undervalued. Over 80% are dissatisfied with their remuneration. More than 75 stated that their working conditions have deteriorated since the pandemic. And alarmingly, over a quarter are considering leaving the profession within next year. However, the sources of dissatisfaction and recognition issues vary between salaried and self-employed nurses. For hospital nurses, lack of recognition manifests in insufficient pay, overwhelming workload due to staff shortage, and a lack of basic resources, issue exacerbated during the COVID-19 pandemic. Nurses were often treated as expendable, moved between departments, and forced to work without adequate equipment. They also expressed a lack of consideration for their opinion by the hierarchy. This interview's passage illustrates this feeling. So we feel like we're not recognized, and it's not just about pay or status, it's about how we perceived. During COVID, I was shuffled from one service to another as if I were just a pawn. And we didn't even have protective overgone. We used garbage bag for protection. I had to wear expired FFP2 masks that were 20 years out of date, smelled horrible, and were moldy. This isn't a myth, it's reality.
This feeling of lack of recognition, along with tensions with the hierarchy, is often linked to the issue of vaccination. Many nurses reported pressure from superiors to get vaccinated, even before it became mandatory. This was perceived as hypocritical, as their safety and well-being were not prioritized during the pandemic, yet they faced scrutiny regarding vaccination. For instance, someone said, when it's about sending us to the front line, no one worries about us, but when it comes to getting vaccinated, they pressure us relentlessly. It feels like contempt. This lack of recognition may influence their attitudes toward vaccination. The institutional burnout gate why some people become skeptical and feel like protesting by not doing what's expected of them. This is particularly pronounced regarding the mandatory vaccine policy implemented in August 2021. I think being forced to vaccinate impacts our freedom and adds another condition to already difficult and unacknowledged working conditions. Regarding self-employed nurses, the interviews revealed various issues related to their dissatisfaction with working conditions and lack of recognition. Their concerns include administrative burdens, work pace, and feeling of isolation at work.
What stands out first is the weight and difficulty of administrative tasks and relationships with doctors and health institutions, such as primary health insurance fund. A large proportion of their time is spent filling out paperwork for Social Security or getting prescription rewriting by doctors to ensure proper reimbursement. Another passage to illustrate. Today, I'm questioning whether I should go stop being a nurse, but what I can't stand anymore is the administrative work. I can't handle rewriting prescriptions. It's really become visceral. I think I'm starting to experience burnout. I write a letter so the patient can have the prescription redone, the doctor rewrites it, but it's wrong. So I write again to ask them to redo the prescription, but it's still wrong. I've had 5 back and forth like this over one prescription. Thus, we can see how a concrete work experience can lead individuals to develop dispositions of distrust towards institutions. The issue of very intense work pace is also heavily emphasized. Self-employed nurses, pay per task completed, have particularly busy workday. Only 47% report being satisfied with their working hours, compared to 62% of hospital nurses. Additionally, thereby responsibility for continuing of primary care, especially in medical desert. In fact, you work all the time, you get phone calls, even when you're supposed to be resting, but people don't necessarily know you're not working. So they call for a blood test, a dressing change. It's literally non-stop work.
More broadly, unlike hospital nurses, self-employed nurses have a very solitary practice. In the interviews, they described the feeling of being abandoned at the end of the chain, especially during the COVID period. They felt poorly informed and supported about the virus evolution and treatments. Several mentioned getting their information from the media, as messages from health authorities were seen as absent, inconsistent, or contradictory. For example, nurse said we could get contradictory orders from various presidents and ministries of health all day long. One moment I wear the mask, the next moment I don't. One moment we need to be confined, the next moment we don't. One moment you can go 10 kilometers, the next you can't. From a labor sociology and political relations perspective, social support at work is crucial. Studies show that lack of support from colleagues or management can lead to resentment and withdrawal. In contrast, strong solidarity is often linked to collective mobilization. Self-employed nurses faced negative reactions from patients and had to deal with their anger and frustration, which increased their feeling of abandonment by health authorities. Several mentioned feeling unprepared to vaccinate their patients. So we continued our work a bit like infantry in the army. We went in with our machine guns, and honestly, we barely had a handgun. We did the best we could because all the protection resources were allocated to the hospitals. So we saw that administrative burdens are seen as unnecessary constraints imposed by institutions leading to distrust. The high work pace driven by the compensation model may cause anger toward institutions, patients, etc. The feeling of isolation in their practice may reflect a lack of social support. These factors contribute to self-employed nurses' dissatisfaction, potentially impacting their trust in health authority and affecting their willingness to vaccinate patients or themselves.
So, in summary and to conclude, the study helps to shed light on healthcare workers' vaccine hesitancy. While the importance of education to enhance their vaccine knowledge should not be underestimated, it is vital to emphasize the multifaceted nature of this hesitancy. In this context, the issue of working conditions emerged as particularly significant. Through their work, the sense of being recognized or not, of feeling valued, having responsibilities and a clear defined role shapes broader dispositions within individuals. In other words, professional socialization extends beyond the workplace. For healthcare workers, their professional experiences contribute to shaping their general view of the world.
From this perspective, vaccines are never merely a strictly scientific issue involving the objective evaluation of a medical tool. For these professionals, vaccines also represent a professional obligation, a task to be performed, or even a public policy object that may provoke contestation. This is why degraded working conditions may contribute to more distant attitudes toward vaccination. More specifically, it explains why feelings of low recognition in their work, tensions with management and health authorities, or even feelings of isolation on the job affect how nurses perceive vaccines. This impacts both their personal vaccination decisions and their approach to vaccinating patients. To better understand healthcare workers' attitudes toward vaccination and to improve their engagement with vaccines, it's essential to take a step back and use tools from the sociology of work, of professions, of ordinary relationships to science and politics.
Thank you very much.
Thank you very much. Any questions? I've got one. I ask my question first. There are many studies that found that there is a gender difference regarding attitudes toward vaccination. So in your quantitative survey, did you find that female nurses were more or less prone to vaccine hesitancy than male nurses? Est-ce qu'il y a un effet sexe, un effet genre sur le...
Je peux répondre en français, c'est bon?
Oui, bien sûr. Oui.
Alors pour l'étude quantitative, je crois qu'en fait il y avait déjà beaucoup de réponses de femmes. Il me semble que je ne crois pas qu'il y ait une différence sur les attitudes.
C'est intéressant.
Ouais.
It's interesting because one of the possible explanations is that on average men may have may be in social positions that are higher than females, and it can be one explanation. So it's interesting that at the same level for the same profession, you don't have a gap.
Et aussi le fait que je crois qu'il y a aussi plus d'hommes infirmiers en libéral qui peuvent aussi jouer sur le fait que...
more likely to be self-employed than nurses hospital. Yeah.
Par contre, il y a des différences entre les cadres infirmières et les infirmières.
Yes, according to their hierarchical place.
Inside nurses, there was a difference between those in a situation managed the others.
Là, je parlais en français, je suis un peu fatigué. Donc, il y a un peu une discussion sur l'origine ou la manifestation de la dégradation des conditions de travail à l'hôpital. C'est-à-dire que tout le monde est d'accord, et ça a été démontré d'ailleurs par des gens en utilisant l'ONDAM, que tout le monde est d'accord sur le fait qu'il y a eu une augmentation de la productivité à l'hôpital. C'est-à-dire que le coût des dépenses de santé a été supporté par l'hôpital plus que par la médecine libérale. Mais après, la discussion, c'est de savoir comment le facteur administratif, c'est-à-dire la charge de travail administrative, liée aux réformes de la santé, avec comment ça s'appelle déjà, la T2A, et toutes ces mesures qui visent à augmenter le travail bureaucratique des infirmières, dont elles se plaignent là dans vos entretiens, et combinées ou pas avec l'accélération du rythme de travail. Moi, quand j'ai fait des enquêtes dans les années 90, c'était clairement l'accélération du rythme de travail avec, par exemple, la diminution de la durée de séjour à l'hôpital, qui fait que les malades dans les lits devaient être changés plus vite puisqu'ils restaient moins longtemps. Donc la discussion, c'est un peu technique, mais enfin, est-ce que c'est l'augmentation du travail bureaucratique, de remplir des papiers, ou bien l'accélération du rythme de travail qui dégrade les conditions de travail? Je ne sais pas si vous avez un avis là-dessus, mais en tout cas, il y a un peu ces deux choses en tension.
Ouais, mais ça, je ne peux pas répondre en anglais, par contre, c'est trop... Technical questions. Je ne sais pas si tu peux traduire pour moi, Patrick, la question que j'ai comprise, mais... Ah, ok. Ok. Alors, je peux répondre en étant à côté, c'est-à-dire que tout ce que tu dis est vrai pour l'hôpital, principalement, mais nous, par exemple, quand on prend tous les verbatims qu'on sort sur le travail administratif, etc., c'est pour les libérales. C'est pour les libérales. Et ce qu'on voit, c'est qu'il y a ce phénomène de bureaucratisation. Et finalement, comme on est sur... on peut pas parler... La T2A, c'est à l'hôpital, la tarification à l'acte, etc. Mais finalement, on est aussi sur quelque chose d'assez similaire chez les libérales. C'est-à-dire qu'il y a une sorte de... Elles sont payées à la tâche, en fait. Elles sont payées à l'acte. Et d'un point de vue même encore plus technique, la nomenclature des actes se complexifie de plus en plus. C'est-à-dire qu'elles sont elles-mêmes pas au courant qu'il y a une nouvelle nomenclature, il y a plein de manières d'être remboursées, etc. Et donc là, on parle pour les libérales uniquement. Ça leur fait passer un temps fou à faire ça, et c'est du temps qu'elles font sur leur temps de pause, sur leur soirée, etc., etc. À l'hôpital, c'est moins ce qui a été mis en avant, paradoxalement. Dans nos entretiens, en tout cas, on a moins ce truc de tes tâches administratives, etc., qui a été mis en avant. C'est pour ça qu'on l'avait compris, isolé dans les les facteurs d'insatisfaction au travail, c'est vraiment moins ce qui a été mis en avant par les hospitalières que par les libérales. C'était vraiment assez unanime cet enjeu-là. Et donc on a une même politique publique qui est différente, parce que ce n'est pas les mêmes acteurs institutionnels qui font, mais finalement qui contribuent à individualiser l'acte, y compris d'un point de vue de la rémunération, quoi.
Et pour répondre aussi à l'hôpital, en fait, nous, ce qu'on voyait, c'était pas que le rythme qui était important, c'était aussi le manque de personnel qui, du coup, découlait sur plus de tâches à faire, avec des postes parfois un peu variés aussi à faire sur le tas, sans connaître forcément les tâches directement. Des personnes, du coup, qui sont là aussi en intérim pour combler les trous, mais qu'il faut aussi un petit peu former, etc., etc.
Pour les gens en Zoom, parce que là c'est traduit en direct. Là.
So Hugo said that paperwork, time-consuming paperwork issue was also an issue for self-employed nurses, and it's also the case for hospital nurses, but not necessarily for the same reasons. And I forgot the second part of your answers.
Moi, ce que je viens de dire,
It's the main argument.
le fait que ce soit surtout le manque de personnel qui pose problème à l'hôpital.
Yes, at hospital the main problem is shortage of workforce.
Thank you. Yeah, you told about, but do you think the new responsibility of the nurses, now they can prescribe and vaccine the children after 11 years, may change their attitude about vaccine? Judith this morning told us about the vaccine hesitancy, the 7C of the nurses, was very different than the GP, but now then they can vaccine and prescribe. Did you find some change with this new responsibility?
Vas-y, commence, je finirai après.
Ouais. Je peux répondre peut-être lentement pour qu'il y ait une traduction. En fait, c'est, on a posé la question à chaque fois de, déjà, est-ce que vous connaissez cette nouvelle possibilité ? Est-ce qu'elles sont au courant de cette nouvelle possibilité et comment vous la recevez ? Et ce qu'on observe, alors c'est encore récent puisque c'était 2023, c'est qu'il y a une réception très ambivalente chez les infirmières. À la fois, elles sont quelque sorte positives parce que c'est une reconnaissance des compétences. On dit voilà, enfin on a des compétences, on nous reconnaît des possibilités supplémentaires. Et en même temps, une méfiance. Parce que c'est aussi de dire est-ce qu'on est déjà surchargé de travail. Tout ça est une manière de pallier au manque de médecins, de répondre à une pénurie de médecins. Et donc nous, on va nous mettre du travail en plus, des responsabilités, y compris juridiques en plus. C'est quand même compliqué de prescrire des médecins, des vaccins, il faut savoir faire, etc. Nous, on ne sait pas forcément. Et donc très ambivalent, à la fois positif pour la reconnaissance, mais inquiète au vu de ce que ça peut poser comme charge de travail, quoi.
So nurses have mixed feelings regarding the fact that now they can prescribe vaccines. On the one hand, they consider it's a kind of recognition of their skills, but on the other hand, it means more work and a way to compensate the lack of physicians.
Et pour compléter, en fait, cette nouvelle loi, du coup, est aussi possible si les infirmières font une formation obligatoire de 10h30. Et cette formation, elle est considérée comme pas suffisante ou pas suffisamment complète pour pouvoir être réellement, donner les clés pour réellement pouvoir prescrire correctement tous les vaccins. Et je pense que là où du coup on n'a pas les données ou les résultats, parce que quand on a fait les entretiens, du coup c'était trop tôt pour savoir ce que ça donnait en termes d'application pour les libérales. Je pense qu'il y a quand même des choses qui vont peut-être être modifiées en fonction de certains vaccins, mais après, pour du long terme, dire que du coup, là, elles ont une responsabilité de prescription, ça peut quand même changer beaucoup de choses, parce que du coup, c'est quand même une autre responsabilité. Ça peut évoluer malgré tout dans un sens de plus de vaccination, quoi.
So we need time to see the consequences of this new ability to prescribe vaccines. And there is a question in English.
Just to answer to Salvadori, we did not. We just interviewed nurses. We experienced the COVID-19 during there was professionals in hospitals or no students or not information.
Okay, but I think there is one of our colleagues wanted to build a project, and his idea was to interview nurses during their formation from the first year to the last year to see if there is some kind of building of reluctant attitudes toward vaccination during their formation.
On a, alors peut-être juste, je m'arrête, juste un mot peut-être, mais on a en France, il y a deux choses qui ont beaucoup changé, c'est la possibilité de prescrire. They can now prescribe vaccines, and there is also new profession. C'est IPA, nurses in advanced practice. Et it's also a new profession, so we don't have the back to analyze really this new profession. Mais en tout cas, je switch comme ça parce que je suis fatigué. mais en tout cas, on voit c'est déjà des profils particuliers. Donc c'est des gens qui sont plus confiants dans les vaccins, qui ont plus de facilité, qui sont plus réceptifs au type de prendre le temps avec les patients, les entretiens motivationnels. Mais c'est aussi des profils particuliers qui le font. Donc de là à dire que c'est leur formation qui leur permet ça, c'est un peu compliqué à dire. Voilà. And thank you very much.
Final words. It's been a long and intense day. Ça a été une journée longue et intense. And we are all exhausted, so the final word will be brief. Comme on est tous épuisés, je ne vais pas parler longtemps. Comme on est tous épuisés, je ne vais pas parler longtemps. As we are all exhausted, my final word will be brief. Yes, I could prepare a sentence in English to apologize for logistic issues, but finally things went pretty smoothly. So yeah, I'm pretty happy regarding this aspect.
Except that there was too much food.
Too much food, yes.
So if you have people interested,
I invite you to take food home.
please.
Nous vous invitons à prendre de la nourriture avant de rentrer chez vous. Because otherwise it will be wasted. Sinon elle va être gâchée. Of course, Pierre, Jerry, and I would like to thank our speakers, but also all the participants for the quality of the scientific discussions we had today. Donc, Pierre, Jérémy et moi, nous remercions non seulement les participants, bien sûr les intervenants en premier lieu, mais aussi les participants à cette journée. We will try to do at least, maybe to do better next year. It may be hard on the scientific level, donc on va essayer de faire une autre journée d'études l'année prochaine, mais je ne sais pas si on arrivera à réunir un tel plateau. Yes, in the meantime, I just want to remind you that our next meeting in Zoom will be on February 28th, as we will have a presentation from Mia Marie Annalin, who is a Swedish professor in ethnology, and his presentation, I think it will especially be interesting for Yvon, as we talked to about the title of the presentation, and we were very interested, which is Apocalyptic Imaginaries and Vaccines. So, in the end of February. So once again, thank you.